Hello students, this is Dr. Gaurav and today I'm going to talk about the exterior of the human skull. Now this is important because questions from this topic are frequently asked during the Viva examination of the head and neck and in the final examination. So what I would like to mention before I start the class is that I'll be deliberately leaving out some details about the anatomical aspects of the skull because I'll be dealing with these details later so that the teaching becomes more relevant. Now, skull. What is the skull? Skull is the bony component of the head, and the skull has got two constituents. So the skull we divide it into two parts. One is the cranium. Cranium is the part which I will now show you. So this is the cranium. And when we add the lower facial skeleton or the mandible to the cranium, now we call it the so skull minus mandible is cranium. And the other thing is you should know how to keep the skull in the anatomical position. So by international convention, the skull is kept in the anatomical position using the Frankfurt's horizontal plane. So what is the Frankfurt's horizontal plane? Now in the anatomical position, the skull has to be kept in such a manner so that the lower margins of the orbit and the upper margin of the external acoustic meatus, they lie in the same horizontal line. So once they are lying in the same horizontal line, the lower margin of the orbit and the upper margin of the external acoustic meatus. So this is the external acoustic meatus and this here is the upper margin of the external acoustic meatus. So the external acoustic meatus and the lower margins of the orbits, they have to be in the same horizontal line. And when you keep the skull in such a manner, when this criteria is satisfied, then we say that the skull is in the anatomical position, that the upper margin of the external acoustic meatus and the lower margins of the orbit are in the same horizontal line. Now, there are different views of the skull, and these are called normas. Now, when we look at the skull from above, then this view is called norma verticalis. And when we look at the skull from the back, then this view is called Norma occipitalis. And when we look at the skull from the front, so this view is called Norma frontalis. And when we look at the skull from the sides, it is called Norma lateralis. And when we look at the skull inferiorly, from the inferior aspect, this is called Norma basalis. So we'll be taking up these normas one by one. So first we take the Norma verticalis. That is when we look at the skull from above. So here, students, you must identify the bones which you can see in this Norma verticalis view. So this bone here is the frontalis. These are the two parietal bones. Okay. And here we have the occipital bone. So Norma, occipital bones, a part of the occipital bone and two parietal bones and frontal bone. So these are the bones you see in Norma verticalis. Part of the occipital bone, the two parietal bones and the frontal bone. Then what else do we see in Norma verticalis? We see sutures here. Now what is a suture? Suture is the joint between skull bones. It's an immovable joint. So the suture, now you see here, this suture is there, which is called the coronal suture, and this suture is here, which is called the parietal, the sagittal suture, which is separating the two parietal bones. So once again I repeat, this suture is the coronal suture. This suture is the sagittal suture, and this sagittal suture continues like this, and then an A is formed without the horizontal line. So this is called lambdoid suture. Lambdoid suture is so called because it resembles the uppercase lambda. Now what is the uppercase lambda? Uppercase lambda is A without the horizontal line. So once again, we see sutures in Norma verticalis. Sutures are coronal suture, sagittal suture, and then we have the lambdoid suture, which represents the uppercase lambda. And what is the uppercase lambda? A without the horizontal line. So this lambdoid suture is separating the occipital bone from the parietal bones. This sagittal suture is separating the two parietal bones, while this coronal suture is separating the frontal bone from the two parietal bones. Now, when we say coronal section, what do we mean by that? Coronal section. Coronal section through a specimen means it is going to divide it into anterior and posterior parts or parts, anterior and posterior parts. While sagittal section is the one which is going to divide the specimen into right and left parts. And so we have here, this is the coronal suture, this is the sagittal suture, and the third suture which resembles the uppercase lambda is the lambdoid suture. Now, from the clinical point of view, the thing which is important from Norma verticalis is fontanelle. Now, what are fontanelle? Fontanelle are membranous gaps in the bones of fetal skull. So that for that we must understand first the concept of bregma and lambda. Now, you see here this point, it is the junction of coronal suture with the sagittal suture. So this is called bregma. Now, in the fetal skull, there is a membranous gap in the region of the bregma. That is called anterior fontanella. And this membranous gap, it closes by 1.5 years of age. So what is the significance of this 1.5 years of age? That this membranous gap, instead of the bone being here at bregma, the fetal skull has got a membranous gap here. So that is called anterior fontanelle. So what is the importance of anterior fontanelle? It helps the clinician in diagnosing the different conditions. For example, if the fetus has got raised intracranial tension or there is a brain tumor, then a bulging can be felt in this region because the bone is not there. And in case there is dehydration or loss of fluid, maybe loss of blood, in that case there will be depression here. So this anterior fontanella is important from a clinical point of view, and it normally closes by 1.5 years of age. Now this point here is called the bregma. Bregma is where the sagittal suture is meeting the lambdoid suture. So this point is bregma. Show you once again. The point where the sagittal suture is meeting the lambdoid suture is called lambda. Now here there is a fontanella in the fetal skull which is called posterior fontanelle. And this posterior fontanelle, this membranous gap, it gets closed by 2 to 3 months of age. So if we examine a fetal skull, we will find a membranous gap in the region of the bregma, and we will find a membranous gap in the region of the lambda. This membranous gap in the region of the bregma or the anterior fontanella, it closes by 1.5 years of age, while this gap here in the region of the lambda, it closes by 2 to 3 months of age. So this has got clinical significance, as I have already mentioned to you. Okay, so this was about Norma verticalis. Now we look at Norma occipitalis. That is when you look at the skull from the posterior aspect. So this is the posterior view or the Norma occipitalis. Okay, now here the most striking feature, students, is this point. This prominence is called external occipital protuberance. So what is the importance of external occipital protuberance or this prominence? External occipital protuberance. It marks the junction of head and neck. Okay. And from the sides of the external occipital protuberance, two curved ridges can be seen on either side. This is for the one side and this is for the other side. These are known as the superior nuchal lines. So external occipital protuberance, this protuberance in Norma occipitalis marks the junction of head and neck, and the curved lines passing laterally from external occipital protuberance are the superior nuchal lines. In Norma occipitalis, we'll stop here. We'll elaborate later on. Now we come to Norma frontalis. Norma frontalis is when you look at the skull from the Norma frontalis. Now, what are the bones here? Well, you can see the frontal bone here. Two nasal bones are here. Zygomatic bone is here. Maxilla is here. Okay. So, in myself, suppose this is the Norma frontal anterior view of my skull. This is the frontal bone, two nasal bones, then the prominence of the cheeks, zygomatic bones, then the maxillae. So these are the bony components of Norma frontalis. Now, Norma frontalis, um, when we look at the skull from the front, now interesting thing here is that we can find three openings lying in almost one vertical line. So what are the three openings? Let us see. One is this supraorbital foramen or notch. One is this infraorbital foramen, and one is a foramen in the mandible which is called mental foramen. So let me show you the mental foramen. This is the mental foramen. So mental foramen, infraorbital foramen, and supraorbital foramen or notch. There are three openings which are lying in one vertical line. Okay. And from each of these three openings, one sensory branch of trigeminal nerve is transmitted. So I'll repeat once again for your convenience. In Norma frontalis, in one straight line, we have got three openings. One is supraorbital notch or foramen, which lies at junction of medial 1/3 with lateral 2/3 of supraorbital margin. One is infraorbital foramen. Okay, so this is lying in vertical line with supraorbital foramen or notch. It is lying 1 centimeter below the inferior orbital margin. And one is this mental foramen, which is lying in the mandible. So from each of these three foramen lying in a vertical line, okay, from each of these three foramen lying in a vertical line, one sensory branch of trigeminal nerve emerges. Now this supraorbital foramen, from it are transmitted supraorbital nerves and vessels. From infraorbital foramen, infraorbital nerves and vessels. From mental foramen, mental nerves and vessels. Now what I was talking about, supraorbital foramen, it transmits the supraorbital nerve, which is a branch of ophthalmic division of trigeminal nerve. Sensory branch of ophthalmic division of trigeminal nerve. Infraorbital foramen, it transmits the infraorbital nerve, which is a sensory branch of maxillary division of trigeminal nerve. While mental foramen, it transmits the mental nerve, which is a branch of mandibular division of trigeminal nerve. So now you can comprehend that from each of these foramina lying in one vertical line, one sensory branch of trigeminal nerve is emerging. Yes. And in Norma frontalis, what else do we see? We see the two openings of the orbits and one opening of the nose. So these are the prominent openings. And bones I have already talked about, which bones we see in Norma frontalis. Now we come to Norma lateralis. Now this is quite interesting. Norma lateralis. So in Norma lateralis, we have got two lines, superior temporal line and inferior temporal line. Now this superior temporal line, this one you can make out, it superior temporal line, it starts from the frontal process of zygomatic bone. This is zygomatic bone. Starts from frontal process of zygomatic bone, and then it goes posteriorly and it fades away. Then we have the inferior temporal line, this one. It also starts from the frontal process of zygomatic bone at that level, and then it passes below and parallel to the superior temporal line, and then it curves downwards and forwards to merge with the supramastoid crest. Supramastoid crest. So this we see is the inferior temporal line. It is going curving downwards and forwards, and now it is merging with the supratemporal crest. So we have got two lines which we see in relation to the norma lateralis or lateral view of skull. Now this inferior temporal line, it limits the attachment of the temporalis muscle. So that is why this inferior temporal line is created. Okay. Now what else do we see in norma lateralis? One thing is we see the temporal lines. Then above the zygomatic arch and below the zygomatic arch, we see two fossae. This is called superior temporal fossa. This is called inferior temporal fossa. Okay. Then what else do we see in norma lateralis? In norma lateralis, we see an H-shaped suture. H-shaped suture. So let me show you here. In norma lateralis, we see. Okay, so let me show you here. Yeah, it's quite prominent here. H-shaped suture. This is supratemporal fossa. This is infratemporal fossa, right? So this H-shaped suture is called. This area is called Tyrion. P-T-E-R-I-O-N. P is silent, so we call it Tyrion. So what is Tyrion? It is a circular area in the anterior part of the supratemporal fossa, superior temporal fossa, circular area which encloses four bones. And what are the four bones here? Frontal bone, parietal bone, temporal bone, and the sphenoid bone. So this is Tyrion. And why this Tyrion is important? This is important in case of trauma to the skull, because deep to the Tyrion or H-shaped suture lies the anterior division of the middle meningeal artery. So you see here markings are there on the inside of the skull. Markings are there on the inside of the skull. And here we have the marking of the middle meningeal vein and the anterior division of middle meningeal artery. So where the Tyrion is, inside to that lies the middle meningeal vein and anterior division of middle meningeal artery. Now students, suppose there is a this Tyrion is the weakest part of the skull. Now suppose there is a trauma here, then what will happen is anterior division of middle meningeal artery lying inside it between the dura mater and the skull, that will get ruptured, and if that get ruptured, a hematoma is formed which is called extradural hematoma, which is formed between dura mater and the skull bone. Okay, so that is why this Tyrion is of clinical importance. Okay, so this is a take home point from this class, that Tyrion is a circular area where four bones meet, and this is the weakest part of the skull, and injury here leads to damage to the anterior branch of middle meningeal artery lying inside the skull, and due to rupture of that artery, a hematoma is formed between the dura mater and the skull, and that is called extradural hematoma. Then another thing which is asked and one wants to know about the lateral view is formation of zygomatic arch. Zygomatic arch has got two components: the temporal process of zygomatic bone. So this is zygomatic bone, temporal process of zygomatic bone. You see the line, this demarcation here. This is the temporal process of zygomatic bone, and this is the zygomatic process of temporal bone. So both of them unite to form the zygomatic. Okay, so this is an important aspect in case of the lateral view or the norma lateralis. What else do we see in the norma lateralis? We see the external acoustic meatus and we see the mastoid process. External acoustic meatus and the mastoid process. So these are some of the important structures which we see in norma lateralis. Okay. And this is the mastoid process. Okay. So then we come to the norma basalis. Norma basalis. Now in the norma basalis, when we study it, we divide it into three parts. One part is lying anterior to the posterior border of the hard palate. So this is an imaginary line which we draw at this level. So anterior to it lies the anterior part of norma basalis. And then this is foramen magnum, an imaginary line passing along the anterior margin of foramen magnum. So from posterior border of hard palate to anterior margin of foramen magnum, this is the middle part of Norma basalis, while posterior to it is the posterior part of Norma basalis. Now we will study Norma basalis one by one. Anterior part of Norma basalis. It is made up of the alveolar arch, which contains the sockets for the roots of the teeth and the hard palate. Now this hard palate, we can appreciate that there is a cruciform suture here. You can see cruciform suture. So when we say formation of hard palate, how is hard palate formed? Hard palate is formed by in the anterior two-third by the palatine process of the two maxillae. So this is palatine process of one maxilla. This is palatine process of the other maxilla. And in the posterior one-third, the hard palate is formed by the horizontal plates of palatine bone. So this is horizontal plate of one palatine bone, horizontal plate of other palatine bone separated by this vertical suture. So how is hard palate formed? In the anterior two-third by the palatine process of the two maxillae. These are separated by this vertical suture. Okay. And the anterior two-third is separated from the posterior one-third by this horizontal suture. And the posterior one-third of hard palate is formed by the horizontal plates of right and left palatine bone. Okay, and so we have done the alveolar arch in the anterior part of the Norma basalis and the hard palate. Then this foramen which you see here, this foramen is the greater palatine foramen. Through it passes the greater palatine nerves and vessels. And we see some small foramina. We see some small foramina here. Can you make out? These are the lesser palatine foramina from which pass the lesser palatine nerves, and these small foramina, they are lying in the pyramidal plates of palatine bone. So one is the horizontal plate of palatine bone forming the posterior one-third of hard palate, and this lesser palatine foramina are in the pyramidal process of palatine bone. So we have done the anterior part of the Norma basalis. Okay, and we have done the cruciform suture which was there, and we have done the different components. Now we come to the middle part of the Norma basalis. Middle part of the Norma basalis contains the posterior opening of the nose, posterior nasal aperture. Okay, and then we have got the pterygoid plates. Now what are the pterygoid plates? There are two plates on either side. This is medial pterygoid plate, this is lateral pterygoid plate. Medial pterygoid plate, lateral pterygoid plate. On this side, medial pterygoid plate and lateral pterygoid plate. So pterygoid plates are two plates which are present on either side. Okay, so they are part and parcel of the middle part of Norma basalis. So what else do we see in the middle part of Norma basalis? We see an oval foramen here which is called foramen ovale. Behind it there is a small foramen known as foramen spinosum, and in relation to the foramen spinosum there is a spinous process known as spine of sphenoid. And then we also see a foramen here which is called foramen lacerum, and then we also have a canal here which is called carotid canal. Once again, I'll show you the components of the middle part of the Norma basalis. You have the posterior nasal aperture here, you have the medial lateral pterygoid plates here, you have got the foramen ovale here, foramen spinosum behind the foramen ovale, and near the foramen spinosum you have the spine of sphenoid bone. Here you have the foramen lacerum, and here you have the carotid canal. So these are the components of the middle part of the Norma basalis. Now an imaginary line passing through the anterior margin of foramen magnum separates the middle part of the Norma basalis from the posterior part of the Norma basalis. Now what are the components of the posterior part of Norma basalis? This large foramen is called foramen magnum. Foramen magnum. And these are the occipital condyles. Okay, occipital condyles, they are they articulate with the superior articular processes of the. Okay, So they are lying here. What else do we see in the posterior part of Norma basalis? Well, if I tilt the skull a bit, this is the jugular foramen. Now this probe is in the jugular foramen, and here you can make out the hypoglossal canal. Let me show you from this side. So these are the occipital condyles. This is right here is jugular foramen, and in relation to the occipital condyles, you have got the hypoglossal canals. So this is hypoglossal. This is occipital condyle. This is hypoglossal canal, and this one here is the jugular foramen. So keeping the skull once again like this, you can make out the jugular foramen, and you can make out the hypoglossal canal. This is hypoglossal canal. This is jugular foramen. Okay. Let me show you the other skull also for clarity. So this is the jugular foramen. Okay, and this is the hypoglossal canal. And this is the jugular foramen. So you can make out some structures here in the posterior part of the Norma basalis. You've got the foramen magnum, occipital condyles, then you've got the hypoglossal canal, and then you've got the jugular foramen. Yes, so these are the structures you can appreciate here. And then passing from the foramen magnum up to the external occipital protuberance is a ridge, which is called the external occipital crest. And from the center of this crest on either side, you have got the inferior nuchal lines. From the external occipital protuberance, we are passing superior nuchal lines. From the foramen magnum to the external occipital protuberance, there is a crest known as external occipital crest, from the center of which two lines are passing laterally called inferior nuchal lines. So what do we see in the posterior part of Norma basalis? We see the foramen magnum, external occipital crest. We see the inferior nuchal lines. We see the occipital condyles. We see the jugular foramen, and we see the hypoglossal canal. Okay, so these are the structures which we see in the posterior part of Norma basalis. What else do we see here? If we see this part here, so, okay, this is mastoid process. So below the external acoustic meatus and in front of the mastoid process. So this, my tip of my index finger is now touching the styloid process. So styloid process is present. Styloid process is present in the posterior part of Norma basalis. What is the location of styloid process? It is present below the external acoustic meatus and in front of the mastoid process. So in front of the mastoid process, here it is below the external acoustic meatus. This is called styloid process, which is quite huge in some skulls. Okay. So what do we see in the posterior part of Norma basalis? We see the foramen magnum, external occipital crest, inferior nuchal lines. We see the jugular foramen. We see the hypoglossal canal. We see the styloid process, which is lying below the external acoustic meatus and in front of the mastoid process. And between the styloid process and the mastoid process, we see the foramen known as stylomastoid. So students, these were the structures which are passing through the different parts of Norma basalis. So in today's class, we have done the exterior of the skull. We have studied that the skull consists of two components, the cranium and the mandible. We have done the anatomical position of the skull. We have done the different normas, and we have identified the main structures vis-a-vis the normas of the skull. So we'll be continuing in part 2 of the class. We'll be continuing with the osteology of the skull, and be with me through these classes, and then I'm sure that as you continue and you keep the skull with you and follow these classes, I'm sure you'll be able to make out the anatomical details of the skull. And I thank you for giving me your time, and till the next time we meet, it's bye from me. Take care. Bye bye.